Welcome students. Today we are going to start part second, allergy, for the revision. So we will learn about which are the tests for use for the allergy. So first test we will explain about the skin prick test and second one is the blood test. Our next topic is that some common allergic reactions. Students, in part first we completed what is mean by allergy and how this allergy is caused due to the histamine, and after that we learn about the allergens, and topic we completed up to the how these allergens are enter in our body. So now our topic is that some common allergic reaction. So next topic of the lesson is the some common allergic reactions, and the first one is the hay fever. Hay fever is usually caused by a reaction to the pollen grains, and that is therefore particularly when it is common when flowers are open, and many people suffer from these pollen grains. The lining of the nasal cavity becomes sensitive and inflamed, and it producing a large amount of mucus. So the affected person from these pollen grains suffer from running nose, then sneezing. The eyes also may be affected in the same way. So it becoming itchy and sore and weepy. When a person reacts adversely to a substance in this way, we say he or she is allergic to it. So these are some common symptoms of the hay fever. So students, always remember that hay fever is usually caused by the reaction of the pollen grains, and these pollen grains are all of the persons not sensitive. Some persons are having the allergy to the pollen grains. That persons only showing these common allergic symptoms that we called as a hay fever. Second common allergic reaction is asthma. Students, asthma is more serious. So the main sign and symptoms in the asthma are the muscles in the walls of the bronchioles contract. So the tubes get narrower, and this makes it difficult for a person to taking the breath, and because of which he or she, that persons are wheezes. The attack are often brought on by the pollen or the dust particles, or occasionally by some kind of food too also, and then the person is allergic for the particular food, for dust particles or the pollen grains. So second condition, second allergic reaction is the asthma. Dear students, in some people the attacks become worse because of their nervousness or worry. Asthma can be treated with drugs which make the bronchial muscles relax. So the tubes widen, which are narrowing, that become the widen, then allowing air to be breathed in and out of the lungs more easily. So in that way the treatment is given for the asthma. So students, the third allergic reaction is hives. Hives is an outbreak of swollen pale red bumps, or we are also called as a patches on the skin, that appear suddenly due to an allergic reaction to certain allergens. The allergens such as medicines or food, that they are showing these symptoms that we called as a hives. The next one is the anaphylaxis. Anaphylaxis is a sudden allergic reaction result in decreased blood pressure and shortness of breath. And the nature of anaphylaxis is such that the reaction can seem to be subsiding but may recur throughout a period of time. That condition, that reaction is the anaphylaxis. So students, we completed here the allergic reactions. First one is the hay fever, second one is the asthma, third one is hives, and fourth one is the anaphylaxis. And the allergens are maybe the pollen grains, dust particles, or some particular medicines or some particular food. So these are the allergens. Now students, our next topic is the precautions to avoid allergic reactions. Everyone appreciated for that. Prevention is better than the treatment. So we have to take care about that particular food, particular medicine to avoid the allergy. There is no permanent cure for an allergic reactions. Medication for allergies do give relief, only relief, but it is not the permanent cure. Those people prone to allergic reaction should be aware of the allergens that trigger these responses in their bodies and avoid them completely, especially the food, medicines. So sometimes anti-allergic shots are helpful to those the seasonal allergies, like that they are caused by the pollen grains. So students, there is no permanent cure. So we have to take care of that particular food and particular medicines. So we will avoid the allergic reactions due to that particular allergen. Doctors specialized in treating allergies should be consulted when allergy is severe. So students, here we completed how to prevent the allergic reactions. So now our next topic of this lesson is the diagnosis of allergy. How to diagnose the person is suffering from some particular type of allergy. So for that, effective management of an allergic disease relies on the ability to make an accurate diagnosis. Allergy testing can also help to confirm or rule out allergies. So we have to do the allergy test for the diagnosis of the particular allergy. And this is the correct diagnosis, then counseling, then avoidance, advice based on valid allergy. This test results reduces the incidence of symptoms and need for medication. The presence of the allergen. If the allergen is there, so for that purpose the tests are there. That we called as a allergy test. To assess the presence of an allergen specific antibodies, two different methods are used for the allergy test. The first one is the allergy blood test and the skin prick test. Both tests are equally valid and are recommended for diagnosis for the allergic reaction. So, due to the diagnosis of allergic reaction, the person improves the quality of life. So, now we are going to explain these two methods one by one. And the first method we are going to learn, that is the skin prick test. Students, listen carefully about the skin prick test. Dear students, in skin prick test is also known as puncture testing, or it is also called as a prick testing. Due to the series of tiny punctures or pricks made into the patient's skin, a small plastic or metal device is used to puncture or prick the skin. Sometimes the allergens are injected intradermally into the patient's skin with a needle and syringe. Small amounts of suspended allergens or their extracts, for example pollen grains, then insect sting proteins, then peanut extracts, these are introduced to the sites on the skin and marked with paint or dye. Common areas for testing include the inside of forearm and the back. If the patient is allergic to the substance, then a visible inflammatory reaction will occur in about 30 minutes. Usually students, in 30 minutes we will see that inflammatory reaction. This response will range from slight reddening of the skin to a full-blown hive in a more sensitive patients, similar to a mosquito bite. Like that mosquito bite, we are able to see the hive. Some patients may believe they have determined their own allergic sensitivity from observation, but a skin test is always better. So students, here we completed the first test, that is the skin prick test, where we are given the injection to our skin part and test is going on. So here we completed the skin prick test. So students, the second test is the blood testing for allergy. In the blood testing of allergy, an allergic blood test is very quick and simple, and it can be ordered by licensed healthcare provider. For example, allergy specialist, that we called as a allergy specialist, is also ordered. Unlike skin prick testing, a blood test can be performed irrespective of age, skin condition, then medication, then symptom, disease, activity, and in pregnancy also. An allergic blood test is available through the most laboratories. A sample of the patient's blood is sent to a laboratory for the analysis, and the multiple allergens can be detected with a single blood sample. And these allergy blood tests are very safe since the person is not exposed to any allergens during the testing procedure. That is why this test is very safe during the pregnancy period also, during the any other disease condition also. That's why the blood testing method is more usually we are appreciated. So students, about the blood testing we learn for that. The test measures the concentration of specific antibodies in the blood. The quantitative allergy blood results can help determine what a patient is allergic to, and it helps predict and follow the disease development, estimate the risk of a severe reaction, and explain cross reactivity. So these are some benefits of the blood testing method for the allergy. So students, here we completed the two methods to test for allergy. The skin prick test and second one is the blood testing. But students, the blood testing is the most favored for the allergy test, because in any condition, in pregnancy condition, in any other disease condition, it is easily checked in one sample of the blood. So multiple allergens can be detected with a single sample of allergy. That's why the blood testing is most favorable. So students, in part second, we completed some common allergic reactions, then how to prevent the allergy, then third we learn about the diagnosis of for the allergy, the two tests. The first one is the skin prick test and second one is the blood testing. Thank you.